this is Suprabha. Welcome back to another session with me. In today's session, we will be discussing about Down syndrome. So basically, Down syndrome is a genetic disorder, and here we can see that the person would have an extra chromosome. So here what happens basically, there would be abnormal cell division, and due to this abnormal cell division, there would be, an extra full or partial copy of chromosome 21. So in Down syndrome, there is actually an extra material from chromosome 21, and that's the reason the individual with Down syndrome would have 47 chromosome in total instead of 46. So because of this, there would be delays in physical and intellectual development. Well, next, moving on to the risk factors. So in risk factors, the first thing could be advanced maternal age. So if the mother is 35 years old or more than 35 years old, in that case there is high chance that the mother might give birth to an infant with Down syndrome. So as the woman's age increases, with that, there is the eggs also becomes older, right? And the older eggs have a greater risk of improper chromosome division. And in case of younger mothers who are, less than 35 years old, in that case also, the mothers who smoke or use oral contraceptives or have a meiotic 2 error, they are at an increased risk as well. And the next one is being, carriers of the genetic translocation for Down syndrome. So both men and women can pass the genetic translocation for Down syndrome onto their children. And the next one is having one child with Down syndrome. So parents who have one child with Down syndrome and parents who have a translocation themselves, in that case, they are at an increased risk of having another child with Down syndrome. So these are some of the risk factors. Now next, moving on to the types of Down syndrome. Well, the first one is trisomy 21. So this is the most common type among all the types of Down syndrome. We can see mostly, almost 95% of Down syndrome cases are caused due to trisomy 21. So here the person has, 3 copies of chromosome 21 instead of 2 copies of chromosome 21 in all cells. So here there is an extra set of chromosome 21, right? So because of this, there would be abnormal cell division during the development. Well, the next one is translocation Down syndrome. So this basically occurs when a portion of chromosome 21 becomes attached onto another chromosome, and this might happen before or at conception. Now this is something where we can see translocation, right? So the chromosome is translocated to another chromosome, right? So that is why the name is translocated Down syndrome. So basically here these children would have usual 2 copies of chromosome 21, but they also have additional genetic material from chromosome 21 which is attached to another chromosome. And the next one is mosaic Down syndrome. Now this is a very rare condition, and in this the person has only some cells with an extra copy of chromosome 21. So the mosaic of normal and abnormal cells is caused by abnormal cell division at fertilization. Well, next, moving on to the clinical manifestations. So in clinical manifestations, the first thing would be microcephaly. So, the size of the head would be smaller, and along with that, we can see flat face with upward slant to the eye, and there would be short and wide neck. Also, if we see the ears, then, it would be small and low set ears. Also, there will be flat nasal bridge. So the nasal bridge would be flat and there would be protruding tongue. Also, we can see brush-filled spots. There would be tiny white spots on the, iris of the eye, and there would be short, broad hands and feet with a single crease on the palm of their hands. And along with all these, we can also see that there would be excessive space between large toe and the second toe, and also there would be muscle hypotonia. So next, moving on to the diagnostic test. So in diagnostic test, we can do chronic villus sampling. So in this, the sample of the placenta is taken either through the cervix or through a needle which would be inserted into the abdomen, and this test can be performed between 8 to 12 weeks. So through this test, what we can do, we can analyze the fetal chromosomes. So that is how Down syndrome can be diagnosed. And next there is amniocentesis. So in amniocentesis, basically they insert a needle through the abdomen and they collect small amount of amniotic fluid. Now this amniotic fluid would be analyzed for the presence of chromosomal abnormalities. And the test would be performed between 12 to 20 weeks of pregnancy. And then there is percutaneous umbilical blood sampling. So in this, they uses a needle to retrieve a small sample of blood from the umbilical cord. So basically in this, they collect the blood from the umbilical cord and then they analyze it for the presence of any chromosomal abnormalities. So this is usually performed at after 20 weeks. So all these diagnostic measures are performed before the baby is born. And then after the baby is born, if Down syndrome is suspected, in that case a karyotype might be performed. Well, next, moving on to the treatment. So Down syndrome is actually a condition which cannot be cured. So the treatment that we would provide would be directed at addressing the individual concerns of particular individual. So if there is certain heart defects or certain GI anomalies, and the child will have hearing loss or vision problems, or the risk of infection is also actually increased in these children. So all these associated problems can be for these things we can provide treatment to prevent further complications or serious complications. Well, next let us learn about the nursing management. So the nurses should obtain a history of mother's pregnancy, their birth history, and the genetic testing should be done. And you also have to observe the physical characteristics of Down syndrome. So we have seen that there might be several problems associated with Down syndrome. So you have to assess, or you have to observe the physical characteristics, and then you also should assess the respiratory function, because there's poor muscle tone, right? As I mentioned earlier, that there would be hypotonia, right? So there might be the respiratory function might be impaired. So in that case, you have to assess the respiratory function, and you also have to assess the heart sounds. You have to check if there is presence of murmur, and you have to assess infants' ability to eat, because they have a protruding tongue, and they also do mouth breathing. So in that case, they might be unable to eat properly. So you have to assess the ability to eat. And you can assess their bowel functioning. So if there is older children, in that case you can you can assess their height and weight, and you can compare with the appropriate growth chart. And you also have to assess their cognitive development. And as they have hypotonia, so there is a high chance that there will be cracking in the skin, there will be dry skin. So you have to maintain the skin integrity. So they have a high tendency towards dry, rough, and cracking skin. So because of that, you should maintain the skin integrity, and you should determine the family knowledge, the coping, and support. Next, moving on to the complications. So in complications, so what we can see is that the 95% of individuals with Down syndrome, they would have mild to moderate mental retardation, and also there would be delayed language, social, and motor development. Then there might be growth retardation, and also there might be congenital heart disease, and atrial or ventricular septal defect might be there. There might be respiratory infections, pneumonia, vision problems, and other than these things, hearing loss is also very common in with Down syndrome, and there might be gastrointestinal blockage or problems. So there might be esophageal atresia, duodenal atresia, or any celiac disease. And there might be thyroid dysfunction, there might be sleep apnea, or increased risk for dementia. Also, they have a high risk for acute lymphocytic leukemia. So next, moving on to the prevention of Down syndrome. So there is actually no such specific preventive measure which can actually prevent the occurrence of Down syndrome. But the couple who are, who are planning to conceive, they can go for genetic counseling. Well, so that's all about today's session. So let us conclude our today's topic here. So today we learned about Down syndrome. And we learned what, how does it happen, what are the clinical manifestations that we can see in the child, and also what are the risk factors and the management of Down syndrome. So I hope you have got a better insight about the topic. Thank you.